The ENVISION Low Air Loss Therapy Surface offers several exciting technologies that caregivers previously only envisioned in a product. The ENVISION Therapy Surface is designed to answer the need for a highly effective surface to prevent and treat pressure ulcers through stage 4 by addressing the critical factors of shear and friction and patient immobility, along with pressure and microclimate management in unique ways. The surface is also designed to improve patient safety by helping to reduce the risk of patient falls, as well as to improve nursing efficiency. Using a combination of software and the patented Pressure Smart sensors embedded in the mattress, the ENVISION Therapy Surface sees the patient position in real time, allowing optimal pressures as the patient sleeps, turns, sits up, or gets in or out of bed. Vertical air cell technology in the heel area helps address this sensitive area. The surface is designed to facilitate patient immersion and envelopment like air fluidized therapy. The result is excellent therapy and comfortable patients. The shear relief system provides automatic surface adjustment for additional skin protection. As the head of the bed is raised, the back and seat section pressures automatically adjust to help reduce surface shear and friction. In addition, multiple layers of 3D fabric shift along with the patient, minimizing shear and friction during patient movement. Low air loss is a feature of the surface which assists in managing the microclimate of the skin. ENVISION delivers high-performance low air loss through a combination of a dedicated low air loss blower, a specially designed low air loss pad consisting of multiple layers of a unique 3D breathable fabric with crush-resistant channels to increase airflow and circulation directly below the patient's skin, and a high moisture vapor permeable stain-resistant cover. Finally, patient immobility is a critical factor related to pressure ulcers. ENVISION incorporates a turn assist feature that helps caregivers more easily turn their immobile patients onto their sides. With turn assist, the caregiver may better manage rigorous and frequent turning schedules. There are two versions of the ENVISION Low Air Loss Therapy Surface available to the customer: a mattress replacement system, or MRS, and a framed version. You can place the MRS on multiple types of bed frames. The surface contains fillers and bolsters that custom inflate as needed for optimum fit and performance on the VersaCare bed, Advanta and Advanced Series beds, Total Care bed, plus other non-Hill-Rom flat deck frames. The ENVISION surface allows articulation of the Hill-Rom frames it rests on, including full chair and chair egress on the Total Care frame. The framed version of the ENVISION Low Air Loss Therapy Surface uses the VersaCare bed system. The advantage of utilizing the ENVISION Therapy Surface on the VersaCare bed frame is that the customer has the use of features such as scale, low chair, flex-a-foot, and hands-free foot controls. For this application, the VersaCare bed will not have SIDECOM functions. The ENVISION Low Air Loss Therapy Surface is intended for use in the following care areas: acute care, primarily med-surg, and critical care, as well as long-term acute care, or LTAC areas. The ENVISION Low Air Loss Therapy Surface helps prevent and treat pressure ulcers through stage 4 in patients who weigh between 70 pounds and 400 pounds, or 32 kilograms and 181 kilograms, and who are between 4 feet 11 inches and 6 feet 4 inches in height. The ENVISION surface is not intended for patients who weigh more than 400 pounds, or 181 kilograms. Placing such patients on the unit may result in patient injury or equipment damage. In this installation demonstration, we'll show the procedure a service technician uses for placing the surface on an Advanta frame. The steps service performs for other bed frames will be similar to this procedure. After the service technician removes and stores the existing mattress as directed by the customer, they will unpack the ENVISION surface and position the therapy surface on the deck. The air hose connection is positioned in the foot left corner. The therapy surface is secured to the deck with the straps provided at each corner. The head end straps are secured first. At the foot end on the advantage deck, the technician raises the mattress stop, then secures the foot end therapy surface straps. To install the air supply unit, or ASU, the technician first adjusts the hanger brackets to ensure the ASU will not interfere with the bed controls on the footboard. The brackets adjust sideways, as well as lengthen, to fit a specific footboard. The technician will then connect either end of the air hose to the air supply unit. The hose ends are interchangeable. The hose must be pushed into the connector until it clicks. The technician then attaches the hose to the hose management hooks on the bottom of the ASU to keep it safely off the floor. Then connects the other end of the air hose to the therapy surface. The power cord is connected at the air supply unit and routed away from traffic areas to prevent tripping. Then it is plugged into the wall outlet. If the ENVISION surface is delivered on a VersaCare frame, there will be two power cords, one for ENVISION and one for the VersaCare bed frame. To turn the ASU on or off, press the power switch, a hard control on the side of the ASU next to the power cord receptacle. To set up the surface for a patient, the technician presses the power switch. After a self-check completes, the therapy surface configuration for the appropriate frame is chosen through the service menu and saved. The ENVISION surface will automatically inflate the appropriate air bladders to custom fit the bed frame chosen. The final step before placing a patient is to enter the patient weight at the Enter Patient Weight screen. Nursing may want to check the patient weight that has been entered for accuracy, and we will review this function later in the in-service. Once the technician enters the weight given to them, the Ready screen appears. This is called the Home screen. When the air supply unit is on and the surface is inflated, the Ready screen appears to indicate there is no patient. If the head of the bed is above 30 degrees, the surface image is angled. The surface image is flat if the head of the bed is below 30 degrees. Notice that Enable is the only active bolded control. All others are shaded, which means they are locked. This helps prevent other features from accidentally being turned on or off. When you press this control, it enables the patient right and patient left turn assist, Max Inflate, and menu controls. These will be discussed shortly. If you do not press a control within 2 minutes, the screen returns to the locked condition. The screen also provides small icons to indicate alarm modes that are set. In addition, the color-coded indicator on the front of the ASU displays the status of the therapy surface. Green indicates the unit is working correctly and no alarms or notifications are on. Amber indicates when a notification is on the screen and flashes when an alarm has been triggered or the system has a serious fault condition. You will see more about these later when we set alarms. Red indicates CPR mode is engaged. Once the patient is in position on the therapy surface, it adjusts its setting to the patient for approximately 1 minute. Notice also that the screen shows the patient icon on the home screen. When the surface reaches the optimal pressure for the patient, the screen shows Optimized Pressure Redistribution Mode. The patient icon and the head of bed display, above or below 30 degrees, will also be showing. It does not show the exact head angle, only whether the head is below 30 degrees or above 30 degrees, since below 30 degrees is an important indicator for pressure ulcer management. Note also that when the head of bed is above 30 degrees, there is an indication that turn assist is locked out. So that we can examine other surface functions, we'll lower the head of bed to less than 30 degrees. Let's now review some ENVISION features. We'll start with the Turn Assist mode. Turn Assist mode helps the caregiver more easily turn the immobile patient for bedpan placement, dressing changes, or to reposition the patient. Press the Enable control, then Turn Assist left or right. The icon view is from the foot of the bed, and left is the patient's left, and right is the patient's right. A screen reminds you to raise and latch the side rails before starting this operation. However, it is important to note that the surface will turn with the side rails down, as the surface and the frame do not communicate. When the head end of the bed is above 30 degrees, do not try to turn the patient. If the head end of the bed is raised above 30 degrees, the amber status indicator comes on, and you will see the message, "Lower head of bed below 30 degrees to use turn assist mode." In this instance, lower the head end of the bed to less than 30 degrees. When you see the message, "Raise side rails to their full position before starting," do the following. Make sure the side rails are all raised and in the latched position. If the side rails cannot be raised, press Cancel to return the unit to pressure redistribution mode. When the patient and bed are ready for turn assist mode, press Start. As the patient turns to their right, the screen shows the image of a patient being turned onto their right side. In actual operation, a bolster cushion in the left side of the surface inflates to assist turning the patient. If you touch the patient right turn assist control again, the turn mode is cancelled and the surface will return to the standard mode. Depending on the patient weight, you will see patient angle begin to tilt within 30 to 40 seconds. Once the bolster cushion is fully inflated, you will hear a beep. Then it will hold for 20 seconds before sounding 3 beeps to signal that the bolster cushion will deflate to return the surface to the previous pressure settings. The screen changes back to optimized pressure redistribution. Now let's review the Max Inflate feature. Max Inflate mode inflates the surface to its maximum pressures to help facilitate repositioning the immobile patient. To turn Max Inflate mode on, press the Enable control and then press the Max Inflate control. The control and surface icon turn orange. The surface inflates to its maximum pressures for 30 minutes. You will hear a single chime when the full inflation has been reached. After 30 minutes, the mattress automatically returns to the previous pressure setting. You can also manually turn off Max Inflate mode before 30 minutes have elapsed. If the Max Inflate control is dim, press the Enable control. Then, press the Max Inflate control. The surface will revert to its original pressures. Max Inflate mode may reduce or eliminate pressure reduction therapy. Use only to facilitate patient transfer or repositioning. The other touch control on the screen is Menu in the upper right corner. To display the menu options, press Enable, then Menu. Pressing the menu control takes you into or out of the menu screen. The drop-down menu allows you to perform these functions: Alarm settings, Comfort adjust, Language, Enter patient weight, and Quick Study in-service system. First, we'll look at the alarm settings. Once alarm settings is pressed, you can set the bed exit alarm, the Remind Me alarm, and the alarm volume. Help screens are provided to explain the use of each alarm. Page 1 of the Help screen describes the bed exit alarms, and page 2 describes the Remind Me alarm. Touching Close returns to the alarm settings screen. The unit can sound an alarm when the patient tries to get out of the bed. This optional alarm can be set to go off at one of 2 different sensitivities of bed exit. To engage or adjust a bed exit alarm, make sure the patient is in position on the center of the surface. Press the applicable bed exit alarm setting. To set the alarm to go off when the patient moves to either side rail or away from the head section, such as when he or she sits up in bed, press Patient Movement. Use this mode when you want to be alerted when the patient starts to move. To set the alarm to go off when the patient's weight shifts significantly off the mattress, press Out of Bed. Use this mode when you want the patient to move freely within the bed, but want to be alerted when the patient leaves the bed. If the patient is not positioned on the center of the mattress when you try to set or reset a bed exit alarm, you will see the message, "Patient must be centered in the bed to set alarm." In this instance, make sure the patient is centered on the mattress. Then press OK. Set the alarm. Press Done. You will return to the home screen and the bed exit icon will be displayed. Touching the silence control stops the audible alarm and dims this control. After 15 minutes without further interaction, the alarm comes back on. From the silence screen, before resetting the alarm, make sure the patient is centered in the bed. Then touch Reset. Note, if in doubt as to whether you reset or turn the bed exit alarm off, go to the alarm settings screen from the menu to check. To disengage a bed exit alarm, at the alarm settings screen, press the bed exit alarm setting off, then press Done. The optional Remind Me alarm may be set to sound an alarm at preset periods. This alarm is useful when you want to be reminded to turn the patient or provide any other procedure on a predetermined schedule. To engage the Remind Me alarm, at the alarm settings screen, press the applicable time period, either 1, 2, 3, or 4 hours, then press Done. The clock counts down the remaining time and alarms when it hits 0. Press Silence once the alarm sounds. Press Reset once ready to arm the alarm for the next time period. To disengage the Remind Me alarm, at the alarm settings screen, press Remind Me off, then press Done. The ENVISION therapy surface automatically supplies the optimal pressure redistribution for the patient's position on the therapy surface. However, to adjust the firmness for the patient's comfort, do the following. Press Menu and select Comfort Adjust. Press On and then Done. Note that the surface only allows firmer adjustments initially. Every time Comfort Adjust is turned on, it starts in the softest setting allowed. Use the comfort adjustment controls to slightly change the pressure in the head, seat, and heel sections of the surface. To increase the pressure, press the up arrow control. To decrease the pressure, press the down arrow control. To return to the main therapy screen, press Done. Note, the home screen patient image now shows the mattress with bars to indicate Comfort Adjust is on. The label in the upper left also indicates With Comfort Adjust. To turn the Comfort Adjust off, at the home screen, press Menu, then press Comfort Adjust. The Comfort Adjust screen will display. At the Comfort Adjust screen, press Off. The comfort adjustment controls will dim, and the unit will return to automatically adjusting the surface to optimize pressure redistribution. Press Done to return to the main therapy screen. Note, do not use Comfort Adjust in any zone where the patient is undergoing pressure ulcer treatment or prevention. Patient injury could result. The unit automatically supplies the optimal pressure distribution for the patient's position on the mattress. When Comfort Adjust is on, evaluate the patient frequently and turn off Comfort Adjust as applicable. You can change the language displayed on the user interface as necessary. To change the language display, press the Language control on the menu. The language screen will display. Press the necessary language option, either English or Español for Spanish. To save the change and return to the previous screen, press Done. The service technician should enter the patient's weight between 70 and 400 pounds upon initial setup. It will not usually be necessary to re-enter the weight during a patient's stay. The only time a weight must be re-entered is if the patient gains or loses more than 20 pounds from their initial weight, or if the power to the unit has been off for more than 24 hours. However, it may be useful to check the patient weight that has been entered for accuracy. In this instance, press Enter Patient Weight on the menu selection. View patient weight in the display area. Use the pounds-kilograms control to toggle between pounds or kilograms. To change the weight, use the keypad to enter a new weight, then press Enter. Use the orange Clear control to clear a new entry. When the weight is correct, press Done to return to the home screen. With Quick Study, the first software-based bedside user instructions, it's easy to learn how to use the Surface through simple-to-access screens and video demonstrations, conveniently available around the clock. To display the in-service data, press Quick Study In-Service on the menu. The Quick Study In-Service menu screen will display. Pick a subject from the 4 categories, for example, Functions and Controls, and press that control. The applicable Quick Study Topic menu screen will display. Now pick a topic, such as Turn Assist Mode, and press. The chosen topic screen will display. Then refer to the simple illustrated steps that show how to use the Turn Assist function. Use the arrow control to view the next page when necessary. Some topics also have videos indicated by the camera icon labeled Show Me along the side of the screen. To watch an in-service video, at the topic screen, for example Turn Assist, press the camera icon. The in-service video screen will display and the video will play. You can pause the video and you can replay the video. After you finish the video, press Done to return to the topic screen. Press Done, then Close to return to the home screen. Please note that the in-service videos are silent by caregiver request. Also note that not all topics feature an in-service video. Now let's look at CPR. To turn CPR Assist Mode on, press the red CPR hard control on the air supply unit. The CPR screen will display, and the Surface will hyperinflate for 60 minutes. Lower the head end of the bed frame separately using the bed control. See manufacturer's instructions for further information. Use an appropriate CPR backboard between the patient and the ENVISION Surface to achieve appropriate chest compressions. Pressing the CPR control on the ENVISION ASU does not activate the bed frame CPR. The bed frame CPR control must be activated separately. When the CPR control on the front of the air supply unit is activated, the light bar on the front of the ASU becomes red to indicate the therapy surface is in CPR mode. This mode remains active for 1 hour. Then an alarm will sound before the surface returns to the previous therapy mode. To keep the CPR assist mode for an additional 60 minutes, press the CPR control before the initial 60-minute period has elapsed. If the caregiver interrupts the CPR mode by touching Stop, a message screen appears. The caregiver then has the option of touching Cancel to remain in CPR mode, or touching OK to return to optimized pressure redistribution. Refer to the bed frame manufacturer's instructions to take the bed frame out of its CPR position. There are visual and audible indications when an alarm is activated. Visually, the caregiver sees a screen with an icon and message which will be very specific about the type of alarm. The alarm condition is also indicated by the amber solid or flashing light bar. Touching the silence control stops the audible alarm and dims the silence control. After 15 minutes, if no other interaction occurs, the audible alarm comes back on. The alarm can only be reset if the alarm condition is resolved and the patient is centered in the bed. There are 2 types of service notifications: service needed and service required. Service needed means that a minor problem has been detected by the system. Service is needed, but basic functionality is retained. This allows patients to remain on the Surface until a replacement or repair can be arranged. If the Service Needed screen displays, first, press OK to return to the previous screen. The previous screen shows a Call for Service reminder and the applicable service code. Make sure the hose is correctly connected to both the ASU and the therapy surface. Make sure the power cord is firmly plugged into the air supply unit and an applicable power source. Turn the power switch off and then on. If the problem remains, Call Hillrom Technical Support for assistance as soon as possible. Only Hillrom authorized persons should service the ENVISION low air loss therapy surface. Service by unauthorized persons could result in personal injury or equipment damage. Note, if the problem still exists after 4 hours, the service needed screen will display again. Service required locks the system and the interface and tells the caregiver to remove patient from unit. In this case, remove the patient from the therapy surface. Press silence to turn off the alarm. Remove the patient from the therapy surface. Turn off the power to the ASU. And call Hillrom Technical Support for assistance. If the ENVISION therapy surface detects that it failed a self-diagnostic test, you will see the message Service Required. Please call Hillrom. For example, when you see the message Service Required, mattress is not properly configured to the frame, one of the following conditions is present. The therapy surface has been without power for 24 hours, or a Hillrom authorized person removed the unit from a bed and it has not been initialized for use on the next installation. Some helpful transfer and transport hints. To transfer the patient to or from the therapy surface, place the bed in the transfer position. Refer to the bed manufacturer's instructions. Put the ENVISION low air loss therapy surface into Max Inflate mode, as discussed previously. Transfer the patient to or from the therapy surface as necessary.